So welcome to Healing in Motion.
Thank you.
Yeah,
I'm excited
yeah,
to sit down with you today. We've known each other for a long time now, and I just love that you're doing this. I think that more information needs to get out to the special needs community. So I love that you've jumped on board and you're picking up some of that slack. And I'm excited to see where our conversation goes today.
yeah. Same. I'm gonna try to keep it as comfortable and fun as possible. Ever since we met, I think that you've truly been a fire under my skin also to motivate me to do more and to truly see myself as a therapist, and that there's so many options out there for therapy, not just traditional pediatric or home health. It's just there's so much more out there as possibilities, especially when it comes into unique experiences like seizure activities or epilepsies. So I thank you for that, because you've really inspired me to do more and get out of my comfort zone, because I think as therapists we kind of tend to fall into the mold of what's been working and not necessarily what the possibilities are. So we met when I was doing surf therapy. With surf and turf. And so how could you just explain your background and your experiences with therapy in general?
Yeah, well, very little up until 11 years ago now. So, a little bit about me. I'm Sara-Kate Boylan. I'm CEO, founder of a nonprofit called Lily's Lighthouse. And um, how I kind of got there was um, a lot of people really don't know that I had a career in law enforcement, and that projected me to Washington, D.C. I worked with like countless international domestic law enforcement agencies. But during my career, I gained some tools to really figure out the medical issues that I was having with my daughter, Lily, who um, suffered from epilepsy and onset at 5 weeks of age. Having a background that was community focused was really the driver behind Lily's Lighthouse and why I founded it. It's all about trying to make change and do better. So that's kind of where I came to Lily's Lighthouse. My experience with therapy, I didn't really have any up until Lily suffered from seizures. And then, she was such a little girl. She was 5 weeks old when she was diagnosed. And we had interactions with therapists really early on. We had occupational therapists, physical therapists, and then speech, obviously, as she was developmentally able to engage in that type of therapy. Um, so really 11 years of seeing what works and what kind of doesn't work. I think there's real value in these type of services in a non-traditional environment, which is where we really connected. Yeah, and we connected and, just had such a wonderful relationship right off the bat. And I just loved your enthusiasm for just thinking outside the box and having all these ideas. And yeah, so you've been a dear friend ever since.
Thank you. I love the parent client rapport and building those. It's confidence builders, right? As a clinician, as I'm growing my confidence, and also the parents grow confidence, and some things work, some things don't work, and you won't know until you throw it against the wall and see what sticks, right? That's kind of my approach, and I'm like, just try it all. Let's see what happens, and there's beauty in that. And so, because coming from law enforcement to obviously a completely different beast of research and epilepsies and seizures. Like, explain your experience with your daughter Lily and her seizure activities.
Yes, you know, Lily was born in 2014. She's 11 now, and her seizures onset at 5 weeks of age, which at the time I didn't really even realize what they were. They just looked like these real fleeting, 3 seconds, 5-second episodes of fluttering eyelids. And Lily was my first baby, so I thought maybe baby gas or something like that. But as the episodes got closer and closer together, she was having one every 3 minutes, and we ended up in the emergency room where we learned she was having complex partial seizures. And we lived in hospital then for the next sort of 5 weeks with trying to understand what epilepsy was, and just really feeling at the time that it wasn't really a big deal, actually. Coming from, a very strong family and a real get up and just get on with it attitude. And I think that's just culturally like the norm in Australia. I didn't really think that this was something I was going to be dealing with long term, but it just came down to really not having a educational piece of understanding what epilepsy is and how hard it is to control. Um, and so, Lily suffered up to 50 seizures a day for the first 7 years of her life. Um, for her, this was a really significantly difficult epilepsy condition to treat. She had failed everything available, 13, 14, 15 different pharmaceuticals. She'd failed a VNS implant in her chest, which is meant to stimulate the brain and regulate and break up any abnormal electrical activity. That actually made her worse and gave her drop seizures, which she had never had. And she was having seizures every 8 minutes when that was switched on. She failed CBD. She was not assessed as a candidate for brain surgery 3 times. So we tried everything and we'd exhausted all options. And Lily just wasn't really doing very well. Um, you know, she was impaired by the side effects of her seizures, and also of the pharmaceuticals. She had fine and gross motor deficits, speech delays, cognition. These are all things that Lily had to deal with as daily challenges for her. Having so many seizures daily, it just would erase any learning that she would and progression that she would have gained. So it was a kind of a vicious cycle for her. And frustrating as a parent because you have a problem, you think, well, I'll take them to the doctors and they'll fix it. And that just wasn't the reality for us.
Yeah. Yeah.
And
That's
sorry. And unfortunately, for a lot of people who are diagnosed with this condition, they fall into the category that Lily does, which is intractable epilepsy and drug resistant epilepsy, which means that if you fail 2 or more medications, the likelihood of any other pharmaceutical controlling your seizure is really low. And if you fall into that category, your outlook just isn't really good.
wow. Wow. That's such a trial, right? I was expressing to you my minimal experience. I mean, aside from my clients having occasional seizures, but having a daughter that had a febrile seizure and just having that experience under my belt, having it your own kid, and the control that we have kind of over our lives, over our finances, over the things that we can control, it's really out of your control, and it is a really scary feeling, especially I'm sure coming to a new country also, because you're the way that things might be done therapeutically might be different in Australia versus America, and the barriers that you've had to go through in that experience are so incredible to hear about, because most parents don't get that experience, and they don't have to go through that trial that you've gone through. Lily's lucky to have you at her side, that's for sure.
Well,
Mhm.
thank you. And I know when I heard about, your daughter having a seizure, it just, you know, I get it. And it broke my heart to hear that. The reality is it's a really quite a common condition, Alex. And when I talk about Lily's journey and story, I want people to really think about the statistics that back this claim up, that Lily's story really is all of our story. because epilepsy affects 1 in 26 Americans. When you think about that, isn't that mind-blowing? It was to me because I didn't know anyone with epilepsy in this until this happened to Lily. But all of a sudden, friends started coming up saying, "Oh, I have epilepsy. I had seizures when I was younger." It's not a condition that people talk about. Now, 1 in 26, we all know 1 in 26 people, right? And so
Definitely.
this really is a stat that affects us all and a condition that affects us all. Epilepsy kills more people than breast cancer every year.
It's
But
incredible.
isn't that really telling that people just don't talk about this condition? So I think it's time that we have more of these conversations and bring it really to the forefront and discuss the limitations surrounding epilepsy and how we can go about really helping these people that need it. Because for those 1 in 26, 1/3 of those are not going to find seizure freedom from traditional medicine. That's the statistic, 1/3. And then if we look at the limitations in the current treatment options, with anti-epileptic drugs, 50% of patients will only find seizure freedom from the first-line drug, and then 25% when they try the second one. And then at that point, you get drug-resistant epilepsy diagnosis. But when I'm looking at the research and then I pull up, okay, well, that's fine, only 50%. But the side effects of these medications are really bad. I mean, a lot of them are black boxed, you know, a lot of them are depression, suicidal tendencies, liver failure. I mean, it's pretty significant side effects. So I did some research on that and brought up that for every anti-epileptic drug, between 25% and 50% of people prescribed with it will abandon the treatment because they can't tolerate the side effects. So when you're getting, okay, 50% this drug works for, well, how many people are actually abandoning that treatment? It's between 25 and 50%, depending on which pharmaceutical it is. We got to do better than that. Okay, so people are choosing, I would rather have my seizure condition than put up with the side effects of the pharmaceutical. I mean, that is just mind-blowing to me and something that really shocked me when I started delving into the research on that.
Hmm. That's such an incredible statistic. I think most parents don't realize that. And you mentioned the parental burden that many parents feel going into that experience, because it really is hard to share. You almost feel like this is my burden, not somebody else's. But expressing what you're going through, and kind of having some common empathy and validation that you're not on this alone. And a lot of parents, I think, 1 in 26, might be going through that feeling of, oh, this is my burden, not somebody else's. And I think it is really healthy to talk about our experiences and share these kinds of options. And just kind of brings me into my next point of why mushroom therapy? Because obviously you've tried it all. You've tried a lot of different options, and a lot of them didn't work. And you were frustrated by the traditional pharmaceuticals, and I don't want to say it's money gouging, but there's some form of people needing to make an income, and them wanting to outsource and work with these connections. And the holistic approach has kind of, no, we'll look at that later. We can't really get income off that. And so going into your mushroom therapy, what got you started on that concept?
Yeah, well, I mean, as I said, when Lily was diagnosed, I had this background. During my career, I was trained as an intelligence analyst. So research is my capability. And when this happened to Lily, I was pursuing all things mainstream medicine. I didn't really care what I did as long as I could fix her, but I was going to go to the research, right, and try and figure it out myself because that's just my training and my background. And I'm a problem solver by nature, and so this was really the biggest problem for me of my life I had to solve, actually. Lily was such a large puzzle. But I didn't start at mushrooms. It took me 7 years to find mushrooms. I mean, I had researched all different types of things. I got interested in mushrooms because there was a renaissance of psychedelic research coming out about 5 years ago, probably a bit longer now. Not with the intention that I was going to give psychedelics to my daughter, but I wanted to understand why they were seeing benefits with psychedelics for brain conditions. Even though Lily didn't have the brain conditions that the research was suggesting benefits with, for all intents and purposes, she has a pretty severe brain condition. And I wanted to see potentially if I could
Okay.
find out some information that might help her. And so after I compiled a dossier on psychedelics, I actually put that aside and went into functional mushrooms and wanted to see if I could find some that might just help her with cognition and just get her into a better quality of life because she just wasn't doing good. Now, I want to really talk about functional mushrooms quickly before I go a bit deeper into the mushroom research, because when people hear about Lily's Lighthouse and mushrooms, they just expect that I'm putting Lily on psychedelics, and I am not. Lily is on functional mushrooms, and functional mushrooms are a variety of mushrooms that are non-psychedelic, but rather distinguished by their adaptogenic properties. Now, if I want to break that down, what does that really mean? It means that adaptogens have the ability to basically restore our system to normal physiological functioning. So they have the ability to rebalance us, to help us with gut health, brain health, inflammation, oxidative stress. There's a list of them that functional mushrooms have been researched for now. I got really, really excited about functional mushrooms. I found a couple that I was interested in for Lily. We tested a test group on them. We felt great. We gave them to Lily, and she went from having up to 50 seizures a day to 9.5 weeks seizure free, and then 2 months seizure free after that, and patterned that way.
Beautiful results.
Which is just mind blowing. You know, Lily, before functional mushrooms, Alex, I mean, you have known her, you knew her in that space. Her physical therapy goal at the time was Lily will navigate her environment and only fall once a day. And at the time, she was falling up to 10 times a day, covered in bruises. We were using rescue meds 3 times a week. Her seizures were really long. I felt like we were running out of time with her. I honestly believe at this point, had I not started Lily on functional mushrooms at the time that I did, she wouldn't be here. Like, that's how strongly I feel about it.
Beautiful. Beautiful results too, going from 50 to very few. And thank you for explaining the non-psychedelic components too, because a lot of times people mention mushrooms or or CBD. It's they always think about the psychedelic components, but you're looking at the adaptogens, the parts that can actually play a major factor in the results that you're looking for her brain condition, and that's beautiful. And you guys did try them prior, right? Before you gave them to Lily to experience them yourselves, right?
Yeah, I mean, we wanted to see how we would feel on them. And, you know, I think when we go back to caregiver burden, I really realized actually how bad I was before mushrooms, because when I took functional mushrooms, I felt like a better version of myself before Lily. And I think I was so off balance. I'd been suffering from PTSD for so long because of the caregiver burden and the amount of seizures that she was having and not having any control, right? Not knowing when it was going to happen. It's like a bomb goes off and it rocks your world. And that was happening all day long for us. So, you know, to be able to take something as a family unit that's affected by this condition, I love that, because nobody ever talks about the caregiver. Everybody always asks, how's Lily doing? Nobody ever asks you how you're doing. And the load that the caregiver takes when you're talking about medically fragile children, significantly disabled children. It's huge. It's an 87% divorce rate. So families are barely surviving.
Yeah, I think that's a common statistic in all families with adults with special needs, and that's such a sad statistic. But it is important to empathize and to really understand the foundational aspects of that, because it is a trial. It's a really really long trial that you know who knows why. I think that there's blessings in disguise, but it definitely takes a checking in of the family member that is carrying the load, because it can be heavy. It can be a heavy load, even though it's invisible, you know.
For
And
sure.
along those lines, what current research have you found in regards to mushroom therapy?
Yeah, well, mushroom papers are coming out all the time right now. Functional mushrooms has really exploded as an industry in the last couple of years. Definitely, when we started functional mushrooms, there were very few supplement companies on the market, and now there's hundreds, and I can't keep up. I'm trying to keep up with who's out there industry wise and what their products look like, but it's getting more difficult. I forgot the question.
No, you're good. No, good. Because I was asking about research. Yeah. So just the current research
Research.
that's
Okay,
working.
get back
Because
to research.
because I think that no, but I do think mushrooms is a hot topic right now, because you're
Yeah,
looking at companies like Mudwater, and they promote coffee that's, instead of coffee, it's mushrooms now, and there's all this cool research of this is working. It's working in an aspect that it's not really seen. And what current research have you seen that has impacted you? I guess you know.
yeah. Well, the research that we're doing is a big one. For in terms of epilepsy, we're probably, as far as I know, the only ones in the world that are conducting any functional mushroom research for the treatment of epilepsy, which is incredible. Lily's case report was just published in the Pediatric Journal of Neurology, which is a very well regarded international and domestic paper, and that has been sitting on the editor's desk for a year and a half. Only 8% of papers get published in that journal. So we're really excited about it. If people want to pull that up, yeah, I'm stoked about it. It's called, the title of the paper is Serendipity Shall Rule the Day, Remarkable Efficacy of Mushroom Extract Powder in Childhood Treatment Resistant Epilepsy. So,
I'll put that in the link too, so if people want to research it,
yeah.
they can look it
Yeah,
up.
and it's in PubMed. So that's really a very well rounded out paper on Lily's journey, and has a whole bunch of backing data of studies that have been looked at with mushrooms and epilepsy, not in a human trial, but in clinical setting with rat model studies. So people can look at that paper. And then we partnered Lily's Lighthouse with the Realm of Caring and Unlimited Sciences for a retrospective functional mushroom study. That is a comprehensive exploration of functional mushrooms for the treatment of epilepsy. We've taken real people who have been using functional mushrooms for the treatment of their seizures, and we have reported on the impact of functional mushrooms on their seizures and quality of life. So that paper is about to be submitted for publication within the next couple of days. We're really excited about it. So we're really excited to get her story out there to the public. We partnered also with the Realm of Caring and Unlimited Sciences for a functional mushroom study. That is a comprehensive exploration of functional mushrooms as a viable treatment for epilepsy. We have just submitted yesterday, actually, that study to the
Yay!
Epilepsy Journal. Yeah. So we're really excited about that. The most exciting part of the data that came out of this quantitative and qualitative study is the epilepsy cohort that suffers from drug-resistant epilepsy, right? And so that is the community within the epilepsy community that have failed two or more pharmaceuticals to control their epilepsy. The likelihood of any other treatment working for them is really, really low. And the findings coming out of our study with this cohort is really, really exciting. 100% of the drug-resistant epilepsy cohort within this study reported positive findings on the way that functional mushrooms affected their seizures, with 74% reporting either seizure freedom or a significant reduction in seizures, meaning less seizures. If they are having them, they're shorter. So this is just an incredible finding and really validating that research needs to be driven on functional mushrooms for the treatment of epilepsy.
It's an amazing findings, I think, overall. It's really cool to see the benefit of those that have tried other therapies too, and to have kind of an outsource, like, hey, this is an option, and to be in the front running of it because it's not been seen anywhere else. And so you doing the studies for it, I think it's groundbreaking, and it is beautiful. I guess that kind of goes into my next question. Do you see mushrooms complementing other therapies like the non-traditional settings, or
Yeah.
I guess that's
Yeah, totally. I think that this right now, where it's positioned, it's a complementary therapy. It's a adjunctive therapy that can be added on. I think potentially in the future, once we get to the clinical study phases and we can push the research further and figure out really how is this working? Is it working on specific brain receptors? Does that make sense for specific epilepsy types? There's a lot of information that's missing from the research right now. But the future of medicine for epilepsy, I think mushrooms will have a really big piece in that. Yeah, I think mushrooms definitely a key piece for sure.
okay. Okay, that's good to know. Have you seen any side effects? Any things that you've noticed, or anything that you should be aware of, or families might need to be aware of?
Yeah, we have had reports, only a couple of intestinal upset that seemed to sort of remedy itself fairly quickly. Whether that was the microbiome in the gut being mitigated by certain mushroom species like reishi, they're known to do that. May be the case, I'm not too sure. But in terms of side effects, that's really all the reports that I have heard. I like to take side effects and flip that sort of up on its head, right? Because when I'm talking about functional mushrooms for the treatment of epilepsy, there's so many remarkable benefits beyond seizure control that I consider side effects, right? Um, we've had reports of kids who couldn't speak before, saying words, couldn't ride a bike before, can ride a bike, couldn't swim before swimming. So the cognitive benefits, the health benefits, gut regulation, kids who were completely constipated, for days on end and starting mushrooms and they're really regular now. So it's mitigated some kind of intestinal issues. And Lily suffered significantly from those as well and hasn't had those problems ever since starting mushrooms. So I like to take the benefits of mushrooms as being like a side effect of this treatment, which is really, really nice to have positive side effects from a treatment option when you're talking about medical conditions. I love that.
I think that's a beautiful outlook because, as you mentioned earlier, all the side effects that people have had from all these different medications, all these different pharmaceuticals they've tried, and to have very minimal side effects is absolutely beautiful. Because I think that the common gut issues are very common, but the ones that you can't understand are the ones that are so chemically based that we don't know what's going in the body, and so it's hard to know without a longitudinal study. And I think that the most holistic approach is probably the healthiest, and I think that you're on the right track there. With Lily's Lighthouse, what are your current goals, and do you have any barriers you've come across to reach those goals?
Sure. Obviously, our primary mission is to fund research that will on functional mushrooms that will result in a therapeutic for the treatment of epilepsy. As I said, we've just rolled out our first study. My next platform is to head straight to clinical study. roughly around $100,000. I'm currently fundraising for that. It's challenging. Fundraising for nonprofits is extremely difficult. You're working 24/7 for free because you believe in a mission, and it's a purpose-driven mission, right? It's when I look at what I'm doing, it's an innovation that came out of desperation that I'm trying to now market and fundraise for, to cause change for many, right? And so the fundraising piece is really difficult. The educational piece, getting the message out there that, hey, it's functional mushrooms that we've been using. They seem to be a thing for seizures. Don't know why. I'm trying to effecate it through funding the research so that we can help many others. That's been challenging. And then really people finding Lily's story and trying functional mushrooms and not really knowing what the supplement industry looks like has been a really challenging piece for me. I've spent a lot of time, Alex, really getting out to industry, specific mushroom industry, and talking to them about, there's a whole community out there that are using functional mushrooms for epilepsy. What does that look like when we're trying to source mushrooms in a medical capacity? And there's certain things I like to look for when I think about that, because when we're talking about mushrooms are bioaccumulators, right? And so they will take up from the soil or the substrate the nutrients that they're grown on. They're great at doing things like mitigating toxic heavy metals, right? So you would never want to pick mushrooms next to a road, for instance. So when we're thinking about a supplement as a medicine, this industry is not regulated. And so in order for you to be able to pinpoint certain products that are of medical grade, you want to be looking for things like, has it been microbial tested? Has it been pesticide tested? Has it been heavy metals tested, right? What are the lab testing that the company is doing on polysaccharides and things like this? Because it really gives you a sense of, does the company care? And are there any fillers, right, in the product as well? What I look for is 100% fruiting body mushrooms. A lot of products out there are grain products, which is a main trigger and inflammation on the body. So I want people to be really careful about what they choose if they're going to choose any mushroom supplements, and know that if you're really going to give this a go, it's not a bottle off the shelf at Sprouts. I mean, you need to do your research and find good products.
That makes a lot of sense. And I think that's a lot of people's mindset. I think that you're thinking about the fears that people might have of where's it getting found, how's it getting cultivated. And I think if people have questions about where to find the proper kinds of mushrooms and doses, do you have any recommendations or where they can find them?
Yeah, I have listed Lily's protocol on our website under the mushroom page, and I've listed also a couple of the companies that I believe are industry leaders in how they really produce their supplements, where they're getting things from. They test it every batch that they make, right? They're really big on making sure that their products are in the best position that they can for the consumer. And also in saying that, I can't give medical advice. I can only list what worked with Lily and report back on stories that people are telling me and the research findings that we're finding. But obviously I've listed as much as I can on our website, and you can go to lilieslighthouse.org. We have a bunch of resources on there. I've listed a lot of medical studies on there. They can always reach out to me also. info@lilieslighthouse.org.
Thank you for that. I guess lastly, do you have any recommendations or advice for parents that might be just starting out this path of their child has a seizure, and it's kind of that uncertainty. So what, from your experience, what advice would you give them?
Don't panic. This is a long journey, and the turtle wins the race and not the hare. Only do one thing at a time. Don't panic because your kid's having multiple daily seizures. Do one thing at a time, be methodical, document everything. It's all about brain patterning. So if you can get the position of, okay, what I'm trying to achieve is less seizures, I'm going to be methodical and try one thing at a time. It's like hitting a tennis ball up against a wall, right? You can learn really well how to do that, and you'll get better at it really fast. And I liken this to how the brain behaves with seizures. So the more you have, the brain learns to have them better, which means they're longer, they're more intense. The less you have, the brain then unpatterns. The less you have, right? Just be methodical about it. Treat it as a long game and not a short game. One thing at a time.
Thank you for that. I think it's going to help a lot of people just trying to navigate that journey. Yeah, I just want to say thank you for your time. This has been really special, and I think really educational. I learned a lot also. So yeah, thank you for your time, and we'll keep supporting Liz Lighthouse and all your research.
Thank you, Alex. You're great. You keep doing what you're doing, mate.
Thanks a lot, Kate.